Welcome to USRB Radio. This is Khalil Hachem with the Local Connections. Thank you for being with us. We have a great program for you today. It is mid-September and fall is around the corner. And with fall comes the flu season and other ailments. The good news is that we have vaccines for most of these diseases. With us this morning is Dr. Natasha Bagdasarian, the Chief Medical Executive for the state of Michigan. Good morning and thank you for being with us.
Thank you for having me on.
Absolutely. Before we talk about the flu, what's the update on COVID? We hear a lot of noise. There's more COVID. I see more people wearing masks than before. What's going on with that?
Well, just like we saw last summer, we did see an uptake of COVID-19 this summer. It was a little bit higher than it was the previous summer, but it's something that we expected. And we typically see this in those warmer months where people are sort of moving back indoors in August, for example, when they're moving into those air-conditioned spaces. And we typically see it across the country. Usually it starts in the South, in the southern really warm states first, and then we start seeing it in Michigan a little bit later. So we saw that. It peaked about a week ago, and now those COVID rates seem to be going down. But we are expecting another peak of COVID this winter, because that's been the pattern that we're seeing. And COVID is definitely moving into more of a seasonal disease. We know that this is a virus that likes to transmit, and it actually can stay on surfaces longer when the weather is cold and dry. And so we're expecting to see an uptick of this in usually January, February time period.
When you say surfaces, what surfaces we're talking about?
Well, all of these viruses, if you think about how people are when they have a respiratory illness, there's a lot of coughing and sneezing. And a lot of people are coughing and sneezing into their hands and then touching things like door handles, going to the bathroom and maybe not washing their hands afterwards. So if you are going to a public space and you're touching surfaces that a lot of other people have touched, you have to just think about germs residing on those surfaces. So COVID, influenza, they can all live on surfaces for a short period of time, which is why it's a really good idea to wash your hands after you've been out in public, after you've been to the restroom, after you've been touching things like door handles in public.
This disinfecting, it works too?
Yep. You can either wash your hands with soap and water or use an alcohol-based hand sanitizer.
How long does the COVID virus live on surfaces?
It doesn't live on surfaces for very long, but it really does depend on the environmental conditions. So it is very quickly deactivated, usually within just a couple of hours. If it's hot and humid and it's exposed to sunlight, it does not last for very long. But if the weather is cold and dry, it can actually last for maybe 24, 48 hours, sometimes up to 72 hours, depending on those environmental conditions.
About strains, do we have new strains or just we're kind of circulating the old strains?
So there are always new strains of COVID coming along. And typically what we see, and by the way, this is the same for influenza, is we see strains that are spreading across the globe and then they work their way to places like Michigan. And so it's really important for us in the Northern Hemisphere to look at what's happening in the Southern Hemisphere in their winter time. So we usually track that. And then our vaccines, because we have new vaccines for COVID and flu in the fall, are based on what's been circulating in the Southern Hemisphere, because we're expecting to see those same strains in the Northern Hemisphere.
Are we still using the same vaccines from Moderna, Pfizer, so forth and so on?
It's the same companies that are making them, but every year they're tweaking them a little bit. And so the reason that it's really important to get your flu vaccine and your COVID vaccine in the fall, it's two reasons. Number one, they have the most updated strains. So they're covering against the most recent strains that we've been seeing. And the second reason is because it's giving you a boost to your immune system over the cold and flu season. So what you do is if you get a vaccine in, say, September, October, that means your immunity levels are really good through November, December, January, February, when we expect to see the peak of those diseases. And typically for about 4 months after you have either an infection or a vaccine, you have the best immunity. So if you get vaccinated now, you're really going to have your best chance of staying safe and healthy through the cold and flu season.
And those for COVID, are they messenger vaccines or are they regular vaccines?
So we've got both as an option. There are a variety of different vaccine manufacturers. Some are the mRNA vaccine and some are not. But to be honest, it doesn't really make a whole lot of difference if you are the consumer. These have all been proved safe and effective. They all have great studies supporting them. They've all been used for multiple years and have been used in hundreds of thousands, even millions of individuals. So I would suggest that this is a really good time to get your flu and COVID vaccine, and the manufacturer is less important. I would just go with whatever's being offered either at your local healthcare provider or your local pharmacy.
Are they free?
So the free vaccines from the federal government, that program has stopped after the public health emergency stopped. But there are still some ways that you can get vaccines for free. So number one, the vaccines are covered by things like Medicaid and Medicare. The vast majority of private insurers also cover vaccines. And then there are some programs that will help to cover the cost of vaccine, even in adults. Vaccines for kids, there's a whole program for vaccine for kids. So I would suggest if you are uninsured, if you don't have any insurance coverage at all, and you would like to find out about whether there are any free vaccine programs in your area, I would talk to your local health department to see if you'd qualify for anything.
If I take or if I took the Pfizer last year, I can take Moderna this year. That should
you can, and actually, there's a little bit of data that suggests maybe mixing and matching is a way to really get your best immunity, because maybe there are some slight differences between the vaccines, and so you're able to get even better immunity. So personally, I mix and match. I get a different vaccine brand every time I can.
As far as the flu, what kind of season do we anticipate?
Well, we always are prepared for anything because these viruses can be difficult to predict. But one thing I will say is we have been disappointed in the number of people getting their flu vaccine. So every year since the pandemic, since 2019, really, we've seen the number of people getting flu vaccines going down. So 2020 was lower, then 2021 was even lower. 2022 and 2023 were the lowest seasons that we've had in recent years. And what that means is there are fewer people with immunity. And if that trend continues, we will again see fewer people protected. And that could mean more people ending up with severe illness, more people ending up in the emergency department in the hospital. And that's what we're trying to prevent. So if you're watching this broadcast today or listening to this broadcast today, I really urge you to get vaccinated, flu and COVID, and talk to your loved ones too. There is very little risk. These are incredibly safe vaccines. I make sure I get these vaccines every year. I make sure my son and my child and my mom and my sister all get this vaccine every year. And it's your best way of boosting your immune system and having a safe and healthy respiratory virus season.
You can take them both together, right?
You can take them both together, yes.
Is it better to space them out, or it doesn't really matter?
Nope, it doesn't matter.
Yeah. And as far as the flu vaccine, this is not really a live virus. This is something simulated, or what is it?
Yeah. So a lot of people, especially with the flu vaccine, there's a misconception that, oh, it'll give me the flu. And it doesn't give you the flu. These are, unless you get a special vaccine, these are not live virus vaccines. These are killed vaccines. They cannot give you the flu. What they can do is make you feel a little bit achy afterwards. And that's actually a sign that your immune system is working, because our immune system is churning out antibodies, and it's making us feel maybe a little bit tired and a little bit achy as a consequence. But they can't give you the flu. For the most part, these are killed viruses in the vaccines, and again, very safe to use. They may not prevent illness altogether, but if you get influenza or COVID, depending on which shot we're talking about, the chances of you ending up in the hospital are much, much lower. The chances of you ending up in the ICU are lower. The chances of you dying are lower. And that's what we want to do. We want to keep you healthy and alive this flu season.
How about transmitting? If I am vaccinated, does it really help with not transmitting to somebody else, or
Potentially it does, because when your immune system is primed and ready for something, there is a greater chance that your immune system will really fight that virus off sooner. And that means less risk to those around you. You're not producing those same huge amounts of virus. So it's not an absolute. We can't say you will not transmit the virus if you get the vaccine, but you're less risk to yourself and less risk to others. So it's something good to do for your whole community. And for example, if you have a newborn at home who's too young to get immunized, if you have an elderly person at home, if you have someone who is immunocompromised, maybe because they're on cancer treatments, getting vaccinated yourself is something that you can really do for your loved ones to keep them safe too.
And do we know, or this is still too early, how effective the flu vaccine in regard to the virus, or this is too early to tell?
It's too early to tell. We haven't entered into flu season yet. We typically know after that flu season. But I will tell you this, and just really being transparent, the efficacy of flu vaccine, it's a good vaccine at keeping you out of the hospital. It's not nearly as effective as the COVID vaccine. The COVID vaccine is incredibly effective at keeping you out of the hospital and out of the ICU. So if I was going to pick one, I would pick that COVID vaccine. Now, I prefer you get both because, again, I really want to make sure that folks are protected, communities are protected, and that we're keeping our hospitals open and functioning without being stretched. So I would prefer you get both. But when we talk about efficacy of those two vaccines, that COVID vaccine has the best data behind it.
I did get both last Friday, and I did feel a little achy, so I'm not sure which one was kicking in my body.
It doesn't matter. Just think that they're both working and your immune system is working over time. So you essentially boosted your immune system for this season.
Absolutely. Now, RSV, who needs it, and should we get it this season?
So the RSV vaccine is a little bit different. So this is a newer vaccine, and this is a one-time vaccine right now. Recommendations may change. Maybe in the future, we'll realize people need a booster at some point. But right now, based on what it's authorized for, it's a one-time vaccine, and there's a formulation for those who are over the age of 65 or over the age of 60 with other health complications, or for pregnant women. For those who are a little bit older, the vaccine is really to keep them healthy and safe. For pregnant women, it's to keep the baby healthy and safe because you're passing those maternal antibodies to the baby. So if you fall into those categories, I would say talk to your healthcare provider and see if you can get that vaccine this season, because again, it's another really good vaccine.
So if I took it last year, I don't need to take it this year?
Nope.
Yeah. And what's RSV?
It stands for respiratory syncytial virus. It's another respiratory virus. And who it really targets are people who are on the older side or have other medical conditions, or babies. So babies going through their first RSV season are at greatest risk of ending up with severe respiratory issues. And, especially newborns who are very young when they're going through that first cold and flu season. So babies who are born in September, October, November, they're at highest risk because their immune systems are so underdeveloped. And if they are exposed to a virus like RSV, it can put them in the hospital. It can put them in the ICU. So if a pregnant woman does not receive the RSV vaccine, there is another medication called Beyfortus. And this is a monoclonal antibody that is offered to babies going through their first RSV season. So, you can do either. You can either get immunized, you can get the vaccine when you're pregnant as the mom, or your baby can take this medication if they are going through their first RSV season. So talk to your doctor about which option is best for you.
Okay. I know we don't have a huge issue with West Nile, and I think maybe a case or two, but this is something normally it ends in September, and should be something we should worry about, or what are the general precautions when it comes to West Nile and other mosquito,
Yes, absolutely. So this has been in the news a lot. There was a case of somebody who died on the East Coast of what's called EEE, Eastern Equine Encephalitis. And then there have been cases that have been really high profile of both EEE and West Nile happening on the East Coast. And we get both of those viruses here in Michigan. And so really what we want to recommend right now is protection against mosquitoes. It's still warm out there. It is still, it is September on the calendar, but it's behaving like it's August. And it's still pretty hot in Michigan. And that means these mosquitoes are active. And the times that they like to bite are at dawn and at dusk. And so the best thing you can do is if you are out in wooded areas especially, but if you are outside at those times, making sure you are wearing long sleeves, long pants, that you're wearing a mosquito repellent that has an ingredient that has been approved to target mosquitoes, and that you're really just taking precautions because they like to breed any place that there's water. They definitely like heavily wooded areas, and make sure that you are using an EPA recommended mosquito repellent.
We're going to take a short break. We'll be right back. Please stay tuned.
As the weather gets colder, it's a good idea to layer up with scarves, hats, and mittens. Another layer of protection this season is to get your flu and COVID-19 vaccines. You can get both vaccines at the same time. Talk to your healthcare provider or learn more at michigan.gov/COVID-flu-RSV and layer up for some added peace of mind. A message from the Michigan Department of Health and Human Services.
Life for Relief and Development has now been rated as one of the best charities for humanitarian aid. Life's humanitarian projects span the globe, and Life is celebrating its 30th anniversary of providing essential life-saving aid to people and communities in 36 countries, regardless of race, color, religion, or cultural background. Where there is life, there is hope. And when disaster occurs here or around the world, including being one of the first responders to the Turkey-Syria earthquake crisis, Life for Relief and Development rushes in to provide food, medical aid, and shelter to those in need. We are looking to help the earthquake victims, and we take 0% overhead on emergency donations. So please help improve these efforts. Learn more about our involvement to help the helpless and bring hope where it's needed most, and make your tax-deductible donation to Life for Relief and Development now at lifeusa.org or call 248-424-7493. That's 248-424-7493.
Welcome back, and thank you for being with us. We're talking to Dr. Bagdasarian, and we're talking about all the things we don't want to really hear about in the fall. We want to enjoy the fall, but it's necessary to do so. And this is something that most people don't want to hear, which is the mask. I see people wearing it. I see some people are not. I know it's a personal preference. I keep it in my pocket, and if I'm in an area that I feel like a lot of people sneezing, I just go ahead and put it on. Is that something we should do? Or what are the recommendations?
Well, if you are in a situation where you would like to wear a mask, I encourage you to use a mask. I think it's your personal preference. But where we really have advice about wearing masks is if you are unwell. So if you're feeling sick, if you have cold, flu-like symptoms, if you're coughing, sneezing, fever, runny nose, sore throat, any of those types of symptoms, the best thing to do is stay at home. So stay at home and avoid going into the public. But there are folks out there who can't stay at home. They must go out into public to pick up a prescription or some other urgent need. And if you're going out into a public space and you are unwell, the best thing you can do to protect those around you is by wearing a mask, because you're stopping those droplets from getting out into the air. So if you are unwell, it doesn't matter what it is. We want you to stay at home or wear a mask. Now, the other thing that I would really recommend is to take a COVID test. So if you're feeling unwell, we know that we're still sort of in a higher COVID time period. Take a COVID test because, number one, it can inform you about your risk to other people. So if you test positive for COVID and you have someone in your family who's immunocompromised, you know that you can take extra precautions. But also, we have therapeutics. So medications like Paxlovid are extremely effective at stopping that virus from replicating. We also encourage you to take a flu test because we've got medications for influenza like Tamiflu So again, the first thing we want you to do is stay at home or at least wear a mask. The second thing you can do is test because you might be eligible for one of those therapeutics. Now, if you test and the test comes back negative, we still want you to stay at home because you may have another virus and we still don't want anyone else to get that virus.
I want you to share it. Yes.
Exactly.
Now, if somebody tests positive to COVID, what are the new regulations? 3 days at home, or what is the regulations or recommendations, I should say?
Sorry about that. If you test positive for COVID, the recommendation is to stay home for 5 days or until your symptoms have resolved for at least 24 hours. So we want your symptoms to be improving. And then after that, you can go into public spaces. It's better to go into public spaces with a mask because, again, you could be shedding low levels of virus. So we're really looking not so much just at timing, but also at if you are doing better. So if you have been without a fever, without taking things like Tylenol for 24 hours, and it shows that you're on the mend, then you can start going into public. But it's better to wear a mask for another 5 days if you can.
And for the flu, the standard recommendations, stay home, take care of yourself, take medication if needed, and then like my grandma used to do soup and water, and any other recommendations.
Those are all really good recommendations. Lots of fluids, hot liquids like chicken broth can be so good for your throat. So stay really well hydrated. You can take over-the-counter medications. Again, we want people to stay at home if they have the flu, and we're really looking at symptoms. So once your symptoms are on the mend and you have not had a fever for 24 hours, you can again start going into public. It's still a good idea to wear a mask, especially if you're going to be around people who are vulnerable. So if you, if you work at a hospital, or if you're going to be coming into contact with little kids who are vulnerable, it's always a good idea to wear a mask. But again, there are therapeutics for influenza too. So you may be someone who would benefit from Tamiflu, and you can talk to your healthcare provider if you test positive and see if that's a medication that could be helpful.
When should you see your doctor if you have the flu?
Right now, we don't have widely available influenza tests at home. So in order to get an influenza test, most people have to go to either a pharmacy or to a clinic. So you may want to go to an urgent care or clinic to get tested. You may want to go to one of these places if you are unable to manage your symptoms at home. So for example, if you have a fever that just isn't coming down with ibuprofen or Tylenol, if you have a cough that you're unable to control at home and you're not getting any rest, you may want to go and see your primary care physician or an urgent care to help with symptom monitoring. And then, of course, if you're having any really concerning red flag symptoms, we'll call them, so things like difficulty breathing, chest pain, you're coughing until you vomit, you're coughing until your lips are turning blue, those would also be good reasons to see someone, and sooner. So those are reasons why, if you're having, for example, chest pain or shortness of breath, why you may want to go to an emergency department or urgent care.
Last time we talked, we were concerned about, not enough children are getting vaccinated, people kind of procrastinating, or the bad publicity about vaccines after COVID. Has that improved? Is it any better?
It's a little better, but not a whole lot. We're still doing worse today with routine vaccinations than we were before the pandemic. So we were at about 75% when we looked at the youngest kids, those under the age of 35 months. And now we're closer to we were at 66%. Now we're creeping up towards 68, 70%. So we've done a little bit better, but we're not where we need to be. And one of the things that's really important to remember is, when we talk about these rates, it's not the same everywhere in the state. There are some communities that have very low vaccination rates and some that have very high. And there is a website, we can share it with you, where you can actually look up the vaccination rates in your school building. And if you've got kids and you're sending your kids to a public school or even to a private school, you can take a look at the vaccination rates so that you know how much they are at risk. and what kinds of things they may be at risk to. So if it's a school with very low vaccination rates, that could be a reason for you to say, oh my gosh, my child has asthma or diabetes, and you take them to your doctor and make sure they're vaccinated. Now, if you go to a school with a high vaccination rate, I would say that's also a reason to say, let's keep that vaccination rate high and still get your child immunized. But knowing what your school's vaccination rates are, I think is very helpful, because knowing and being aware of these trends and patterns is really helpful to me as a parent. And I'm sure it'll be helpful to other parents out there as well. But we're starting to see diseases that were once eradicated. We're starting to see diseases come back. So we've had a bump in the number of measles cases this year. We've had 7 in our state, and we've seen a bump in the number of pertussis cases. And pertussis is whooping cough. It's that horrible cough where kids are struggling to breathe, can end up even in the hospital. And again, we've got a vaccine for this. So let's use all the tools we have to keep our kids safe.
Wonderful. Is there anything I haven't asked you that people need to know?
I think you asked me everything.
Wonderful. Thank you so much. I really appreciate you taking the time to be with us. This is great information, and I hope that everybody has a safe and healthy fall. Thank you so much for being with us.
Thank you. Thank you for having me on.
Absolutely. We're going to take a short break. Please stay tuned.
Hey, Michigan, let's think beyond the sink and learn where the water your family drinks every day comes from. Private wells and public water supplies allow homes across Michigan to draw water from different sources, like lakes, rivers, and groundwater. Tap into the facts about your home's water source and learn about your home's water quality to protect your family's health. Visit michigan.gov/care for MI drinking water. A message from the Michigan Department of Health and Human Services.
At Top Rehab Physical Therapy Clinic in Dearborn, we provide effective physical therapy sessions in order to limit pain and discomfort. Top Rehab provides physical therapy care for any diagnosis prescribed by a physician, and we regularly see and treat conditions such as stroke, TMJ, fibromyalgia, sciatica, joint pain, and more. We use a variety of pain management methods, including modalities, soft tissue mobilization, and therapeutic exercise. If you're in need of physical rehabilitation or physical therapy, get the highest quality health care at Top Rehab. Most insurance is accepted, and we're open Monday, Wednesday, and Friday 8 to 6, Tuesday and Thursday 8 to 5, and Saturday 10 till 2. Call for an appointment today at 313-846-0555. That's 313-846-0555. Choose Top Rehab Physical Therapy Clinic on Michigan Avenue in Dearborn. Life's too short to be in pain.
Are you going to start a restaurant or grocery store soon? Do you need floor plans and designs? Call Najee Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Najee Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Najee Abood, 734-744-9796.
Welcome back, and thank you for being with us. This is Khalil Hachem with US Arab Radio. We are going to shift to a different topic. Yesterday, the Feds cut interest rates by 0.5 point, a first cut since 2020. The cut is huge. We thought that they were going to give us a 0.25 point this month, another 0.25 point next month. But they went ahead and gave us a 0.5 point, which means that they have a great faith in the economy and they feel like they have great control over inflation. Their target inflation is, 2%. They said they're pretty close to that. How does that affect you? How does it affect me and you? Well, it makes borrowing easier. If you're buying a car, your credit cards, and if you're buying a home. With us this morning is Zulfikar Bassi, CEO of One Home Loans in Bloomfield. Good morning, and thank you for being with us.
Good morning. Thank you for having me.
Absolutely. I appreciate it. So how is that going to Is it going to make borrowing easier? What does this cut mean for people who are buying a home?
Yeah, absolutely. It makes borrowing a lot easier. Like you mentioned, the Fed cut the rates, which helps lower rates on loans and credit cards, which ultimately mortgage rates follow behind and follow suit, which makes it a lot easier and more affordable for clients get approved for their home.
Yeah. What's the rate today?
Mortgage rates are anywhere between, we've seen as low as 5.375 to about 6% for an average consumer. And at one home, we're shopping the top lenders to find the best rate for tailored for that client.
Absolutely. I remember when I bought my home in 2004, which is rates were normal. My rate was about 5.2, which is if we are between 5 and 6, basically that's a good rate.
Oh yeah, absolutely. Especially in this market, makes it more affordable for clients.
Yeah, yeah. I mean, those 2 and 3%, we're not gonna go back anytime soon to that. Those are like a one-time thing happen, is not coming back. We're not, people don't have to dream about these things because they're not gonna come back.
Yeah, absolutely. Those times are done and over with, but hopefully we'll start to see a more affordable downturn in the market for our clients.
Yeah. Is it normal to say that 5%, around 5%, that's a normal and an average interest rate?
Yeah, absolutely. In this market right now, it is. What we've been seeing is clients that have purchased a home in the past 2 years, we're able to save them on average, about $200 to about $100 on their monthly payment with just a simple rate and term refinance.
So, and there are other programs as well. It's not like one set program when you're dealing with a client. If somebody comes in, depending on their situation, their finances, what they owe, and that makes a big difference in the rate. Is that correct?
Yeah, that's correct.
Yeah. So basically, what determines the rate?
Yeah, as far as the rate, as far as a client's profile goes, it depends on their credit score, the amount that they're putting down on a home if it's a purchase, their debt to income. So any type of monthly bills that they might carry month to month, such as credit cards, auto loans, and any other personal loans, that helps determine a client's profile and their rate.
The rate. And when it comes to how much I can borrow, what is that determined by?
Yeah. So with rates being more affordable, it ultimately helps clients be able to qualify for a larger loan amount. And what this essentially means is they're able to have more monthly cash flow as far as their monthly bills go, and not putting a strain on borrowers as far as their monthly payment.
So if somebody when the rates were high, if somebody was able to borrow like $200,000, now the rates are less. Does that mean they can borrow now maybe 220, 225?
Yeah, it absolutely does. It means that they could qualify for a larger loan amount, but all in all, you want to make sure that when a client's qualifying, they don't just want to overstretch their budget, and that's what's really important with this downturn in the market. It allows clients to, like you mentioned, get a larger loan amount, sometimes even put in a overbid on a house that they might really love and want to purchase.
Yeah, I hope we don't get into the overbidding.
Yeah,
that was not
not
fun. Yeah, that was not fun. I hope we don't get into that. What are your recommendations for people who are buying a home? People come to me and they say, I want to buy a home. And I say, well, you need to talk to somebody in regard to the loan. But before getting a loan, they need to get their finances in order. What are your recommendations? Because, some people, they want to buy a home and they go out, take a loan, buy a car, do stuff like that. And that's going to affect them.
Absolutely. Yeah. So step number one, and always number one, is get pre-approved. You want to know how much you could afford for that home before you go out shopping and start looking at homes. You want to make sure that you could comfortably afford that monthly payment. So start by getting pre-approved, talk with a lender, just like us. We shop the top lenders and make sure that, we bring back a tailored offer for that client based on their profile.
Absolutely. So some of the do's and don'ts when you want to buy a home. Could you share some of those with us?
Absolutely. Yeah. So making sure that you're not applying for any credit card or any other loans in process. You want to make sure that, your credit is where it's at when you apply. And then if anything, it'll improve. You don't want to apply for any new credit. simply put as well, just making sure that you're not pulling your credit as well. So not applying for new loans, not pulling your credit, and ultimately not making any job changes as well, because that could affect the client's profile as well, and
Sure,
if they're
sure.
able to qualify or not.
Yeah, depositing money in the bank. What does that do to if you're applying for a loan?
Yeah, so I mean, ultimately, most you want your down payment to be seasoned inside the bank. It needs to be sourced. So with that said, you want to have it seasoned for at least 60 days inside the bank, and you're not able to use cash. So you want to make sure you prep ahead and make sure you have that bank, you have the money in the bank.
Some people come to me and they say, I have the cash at home, and I say it's not gonna work. You're not buying watermelons here. You need to put it in the bank. It needs to be in the bank, and then the source of it needs to be clear before you can really consider it for. When it comes to gifts, some people say I can get a gift. What does that mean?
Yeah, so gift funds just simply means that you're able to receive a gift. You're able to borrow money from a relative, such as, if I'm paying for buying a home, my father will be able to lend me, gift me money, as far as I don't have to pay it back. It's just a gift letter that he's giving me that money and I don't have to pay it back.
Yeah. Is there an amount on like how much of a gift I can get?
Yeah, so there's different there's different minimum borrower contribution depending on the loans. Sometimes you need a minimum of 1% contributed towards a loan. But most of the time, no, there is no cap on how much you could receive as a gift, which really helps our clients when they're purchasing a home.
Are you seeing, or do you expect more and more people to apply for loans now?
Yeah, absolutely. Especially with this downturn, we've seen a ton of clients qualify and save more money on their monthly payment, especially if they purchased in the past 2 years. So
Sure.
a lot of people have been applying for rate and term refinances. In the past year, we haven't really seen much of that because, like you mentioned, in COVID, rates were as low as 2%, 3%. And those days are far behind us. But in this market, where people have purchased at 7%, 6%, and they're able to drop to 5%, that's able to save them at least anywhere from $100 to $200 on their monthly payment.
Sure. I've been told that if you get a loan with an ARM, you can always get a better rate, and then you can refinance later. Is this still true?
That's correct. Yeah. So an ARM is usually lower one of the two, as far as like having an ARM and a fixed rate mortgage. And the fixed rate mortgage just simply means that it's fixed for the life of the loan. With ARMs these days, they're actually fixed for anywhere from, if you choose a 5-year, 5.6, or a 7.6, which is the first number just simply means that it's fixed for the first 5 years of that loan. And then after the 5 years, it starts to fluctuate every 6 months.
But you can, if before that time, you can refinance.
Absolutely. Yeah. There's no limit as to when you could refinance on any of those loans, on any of our loans.
Yeah. Tell us a little bit about your firm. You're in Bloomfield, and you've been in this business for some time, and tell us a little bit about it.
Yeah. So as far as our company goes, we started off back in 2021, just as rates started to turn up. But we rode it out, and we've been growing year by year. And just simply put, we've grown into a new office here in Bloomfield Hills. We're growing our team as well, and we've added more team members on our team as well. So it's been a
wonderful.
great turn.
Yeah. If somebody needs to reach you, how they can reach you?
Yeah, absolutely. Over here at One Home Loans, you can reach us at 313-744-0033. Also on our website at myonehome.com. They could just simply apply directly on there.
And could you repeat that website?
Yeah, myonehome.com.
Okay.
It's MYONE home.com.
Okay. And the phone number, please?
313-744-0033.
Wonderful. Is there anything I haven't asked you that people need to know when it comes to loans?
As far as just getting approved and making sure you're getting pre-approved essentially before you apply is a huge part, especially when you're purchasing. But with One Home, I mean, our average clear to close is 9 days as well. So it really gives borrowers a stronger offer, especially on purchases. So it's really good to talk to a banker before you go ahead and even apply or decide to make any changes.
Wonderful. Thank you so much. We appreciate you taking the time to be with us. One more time, give us the phone number.
Yeah. Phone number is 313-744-0033.
Wonderful. Thank you so much. We're going to take a short break. We'll be right back. Please stay tuned.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shama, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shama at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio toll-free at 855-952-9600. 855-952-9600.
In a perfect world, everyone would be a perfect driver.
Hands at 9 and 3, everyone.
9 and 3.
Everyone would follow all the rules.
Please, go ahead and merge. I'll make room.
Thank you, fellow driver.
And nothing unexpected would ever happen. Even the squirrels would know the right time to safely cross the road. In this perfect world, you wouldn't have to wear a seatbelt. But in case you hadn't noticed, we don't live in a perfect world. About 1,000 people in Michigan die each year in vehicle crashes, and thousands more are injured. Wearing your seatbelt reduces your risk of death in a crash by 45% in a car and by 60% in a pickup truck. So until we find a perfect world to drive in, make our imperfect world safer by buckling up. A message from the Michigan Office of Highway Safety Planning.
Every Thursday in Michigan at 5 p.m., award-winning columnist and journalist Ray Hanania hosts the Ray Hanania Radio Show, presented by the U.S. Arab Radio Network on WNZK AM 690 Radio and brought to you by Arab News Newspaper. This season's focus is on the U.S. presidential elections. Will it be Donald Trump, Kamala Harris, Robert F. Kennedy Jr., or Dr. Jill Stein? Veteran political analysts and elected officials will join as guests. Join us every Thursday at 5 p.m. on WNZK AM 690 Radio for the Ray Hanania Radio Show, presented by the U.S. Arab Radio Network, a special on the presidential elections. Shows are rebroadcast each Monday at 5 p.m. Get to know more about the show at arabnews.com.
Welcome back and thank you for being with us. This is Khalil Hachem. I would like to take this opportunity to thank Dr. Bagdasarian for being with us. One quick note in regard to vaccines. Some of you may feel differently about them, but they do work. And they have worked for a long time. They're available. The good thing about vaccines is that they're not designed to protect you 100%, or they're designed to help your body fight the virus. It doesn't matter what virus it is, whether it is COVID or whether it is the flu. So it's really important to take the vaccine. It's also important to take the vaccine for people in your home, because if you are vaccinated, then when you pass on the virus, it's very weak and it does not affect other people as much as where you're not vaccinated. If you have children, if you have elderly people in the house, it's really important to do that. When you're mixing with other people, it's really good to do that. So I urge you to take the vaccine. It's very important. And don't listen to the propaganda about vaccines. Talk to your professional. To your doctor, that is. Your doctor is the best person to tell you whether you should take the vaccine or not. And this is what I would really do instead of, using, listening to propaganda for anti-vaccine or pro-vaccine. Just talk to your doctor. Ask your doctor, should I take the vaccine? Am I the person that I should take the vaccine? Specifically, if you're elder or for children, pregnant women, always talk to your doctor and see what your doctor said. There is another vaccine we didn't get a chance to talk about, and that is for shingles. If you are like me, someone who had chickenpox when they were growing up, the virus lives inside our bodies, and then it strikes when when we least expect it. Shingles is very painful, and it can hit you anywhere. It can hit you in your body, in your face, and any other places as well, and it could leave marks forever. Sometimes it takes 5 to 6 months to really heal from shingles. I took the shingles vaccine a while back, and then two years ago, I noticed a rash around my abdomen. So I went to the doctor to check out the rash, and he said, "What you're getting is shingles, but it's very mild because you've been vaccinated. Had I not been vaccinated, I would have suffered for weeks and weeks on end with terrible pain and leaving marks forever on my body. And sometimes, again, it takes months to really to heal." And it's a 2-dose vaccine. It's very good for the body. It's very good for you if you're over 50 and you don't have to deal with that horrible pain and horrible disease. We did talk about it with Dr. Bagdasarian, and the fact that some people have not vaccinated their children. Again, there are very important vaccines that children should take, and we've all taken them. We've survived them for years, so don't worry about it. Again, talk to your children's doctor and ask them, am I caught up? What should I take? And listen to that professional. If we have a car and there's something wrong with our car, we take it to a mechanic. So if there is any health concerns, go talk to your doctor. See what your doctor said and follow those, because this is why you select a good doctor, so they can give you recommendations. And I want to go back to the interest rates. So much for the vaccines. Now I want to go back to interest rates and then give you an update on the housing market. Okay. Interest rates have been cut 0.5 point, which is huge, which means now you can afford more home. Now, the flip side of this is that normally when interest goes down, then the price of homes go up, and there's more competition out there for you to get a home, which is okay. It makes it a healthy market. So if you've been on the border, like you want a $300,000 home, or you want something like 350 or 400, and you haven't been qualified for that, well, now with the cut, it can give you that boost, or it can give you that comfort if you're at a $300,000 home and then you're not sure whether you're gonna go over a little bit or not. This gives you that confidence to really get a home. And as the Fed said that they were going to continue cutting interest rates, which means the market is going to be more competitive, and then the prices are going to go up even more. So if you're in the market to buy a home, this is really a good time to buy, because later on, when the interest drops, you can always refinance. And this way you're buying a home with less competition, and then you're buying a home at a lower price. Lower price is very important because you're paying less taxes. And this way it goes a long way, because interest rates go up and down. Taxes, they go up. Every year they're going to increase. The city is going to increase, or the township is going to increase their taxes on you. So it's very important to do that. And, the market is very strong. We've got more homes on the market. And then we are at the point where we can, right now, because of the demand for homes is still strong, but you don't have that huge competition, which we can talk to sellers and we can negotiate with sellers. So if you're on the market, if you need a home, you need a home, period. There's really no ifs and buts about it. But if you can wait, you can wait a little bit, but the home's going to go up. But if you need a home, why rent? The average rent today is about, a decent home is about $1,600-1,800, depending on the location. Some of them are $2,000. $2,000, that's $24,000 a year. in 2 years, that's 48,000. That this is your down payment. If you're able to put 48,000 in rent, why don't you buy a home? Buy a home. It's your home. You benefit from the taxes. When you file your tax returns, it is your home. Nobody's going to get you out of it. And, heaven forbid, if you're renting, something goes wrong, they can get you out of that in about 2 months, because they give you 1 month notice. And then after the 1 month notice, what happens? They take you to court, and they go to court, they get an order, and they get the police, and they get you out. If you're in a home and something goes wrong, it takes a lot longer than that. And then you can deal with the bank, and hopefully within that span of 11 months, 12 months, you get a chance to straighten things out and stay in your home. And it is your home. You can make it any way you want to. So if you've been thinking about it, this is really a good time to do that. And if you have a home for sale, this is still a good time to sell, because the market is up. And then you still can get a really good price. The recent, I'm sure you've heard the news about the National Association of Realtors and their legal issues. Really has not changed much. It's still the same thing. Now, instead of listing what the commission is, now it's negotiated with sellers and buyers. That's the only difference. But we're still doing the same thing. We're still doing the same job. And here's the key. If you want to buy a home, you want to be with a good team. A good team is someone that is a good realtor that knows the market and knows how to help you get a home, negotiate the price, do the paperwork, make sure you're protected. There's a lot involved with buying a home. It's not just like, okay, I find a home and then we buy it, and just like you're buying watermelon. This is totally different. There's a lot of work involved. You got to make sure all the paperwork is correct. You make sure the history of the home is correct. You're not buying a home that has a problem with the deed. So a good real estate agent, what that person does is that makes sure that it takes the stress off you when it comes to search. And I know you can find a lot of homes online, but this is not accurate information. We as realtors, we have our own system, which includes a lot of information that is accurate, up to the minute. We can talk to each other, and then we can get you the home you want, and we can get you the deal you want. Okay. And this is also a good realtor. A good realtor comes to you with a good team, meaning that we make recommendations in regard to finances. We make recommendations in regard to mortgages. We make recommendations in regard to title insurance, because buying a home is three things: finances, and real estate, and then title. Title companies are independent entities. Their job is to do the paperwork and make sure that they're done correctly, and they're done in a good way to make sure that you are protected, that everything is done right. And a good real estate agent tries to work with all of these people, plus working with the agent that represents the seller, to stay on schedule, explaining to you what needs to be done and how it needs to be done. For example, I provide you with a buying guide. The buying guide, it's a small booklet. It tells you every step of the way what you need to do. And like Zach said, when we were talking about interest rates, we talked to you about, make sure you don't open a new credit cards. Make sure you don't go ahead and buy a car, lease a car, and making big withdrawals, making big deposits. They have to stay there you have to show stability in your account for 60 days. That's 2 months. And then you have to show all that money. And then the buying guide has all that information for you, so you can become educated on the process, so you can follow up with the process. One of the most important thing about the buying guide is there's a piece of paper there where it asks both. For example, in most cases, it's a family that's buying a home. It's a man and a woman, and both members of the family. and each one have different expectations, you know, in the buying process. What one person want and what the other person want may be different, and if we're not on the same page, we're going to be doing a lot of searching, and we don't want to do that. You know, we want to make sure that the family or the couple are on the same page, and then we go ahead and in that sheet it asks both of you to fill out what's important to you in a house. Okay. And we're talking about the characteristics. What kind of house are we looking for? And we want to make sure that this house matches your budget. Okay. And if it does not match your budget, so what, you like this house, so you can't afford it, you're going to be disappointed. We don't want you to be disappointed. We want you to be happy. We want happy ending. We want to close. So what we'll do is we'll make sure that that we are on the same page, that we're searching for the same, and then we talk about the area, what area that you want to be in, where you work, and then where you live, where your children, what school your children are going to go to. So all of that is very important. And then that allows us to really be on the same page and then looking for the same home. Buying a home is three things. First, the community and the area where it is. That's very important. Second is the curb appeal, how it looks on the outside. Are you happy with it? And third, what we call is the flow. When you go inside that home and what it is you see, does it work for you? Okay, is it open? Does it have, are the bedrooms on the second floor, first floor? Is it ranch? Is it whatever it is, does it really work for you? Because these three things, you can't change area. It is what it is. And curb appeal, it's difficult to change. It costs a lot of money to change the way the house looks on the outside. The flow, you can change the flow, but that could involve moving walls and doing all of that, and you don't want to do that. Okay, you want to make sure that this house is yours. This is the place where you're going to be, and that works for you. The whole idea is to get you there, with less hassle as possible, and working with good financial person, because finances are an important part of the deal. If you can't get finances together, you can't close on a home. This is why we make recommendations with people that we know and we trust, that they're really good people, and they are people who really know what they're doing. They're not going to disappoint you. They're not going to tell you, yes, this works, and then it doesn't work. They know what they're doing. It's very important. I've been working with people who've been in the business for years and years and years. They foresee problems, and then they fix them before they become problems. So they're incredible. And this is what you need to work with. And then this is why it's very important to work with a good team. It's very important to, and then there's this trust issue. You have to trust your realtor. You have to trust your mortgage person. If you can't trust them and you're going to keep second guessing them, it's a problem. I work with people sometimes and they're second guessing me all the time. Well, it doesn't work out that way. If you know what you're doing, why you hire me? Why are you spending money? Okay, do it yourself. Otherwise, if you listen to me, it'll save you a lot of problems. The number is 313-819-0101. 313-819-0101. If you have any problems, you have any issues, any questions, you're selling, you're buying. I also work in commercial. Half of what I do is commercial, and land zoning and land use and all of that. Just give me a call, 313-819-0101. You can find a lot of information on real estate at yammichigan.com. It's, you can visit us, yamichigan.com as well. But the number is 313-819-0101. Thank you for everyone. Thank you for our team for their production. Thank you for all the guests on the show. And you have a wonderful weekend. Bye now.